clearly? All right, my name is Dr. Nurse Paul. So today we're gonna be doing an NCLEX class. It's a next generation NCLEX class. So I will share a case study for today's class. All right, and you guys can join me in the comment section. I know we're live streaming in multiple platforms via AMN Healthcare International. Thank you for hosting this show. All right, so we are in partnership with AMN Healthcare. All right, um, we're doing a class under AMN Healthcare. Let me just see if I can. Um, I think we can see that thing at the bottom. So maybe we can move that to the top. All right. If you guys are joining, please join us via the comment section. So let me just some technical error here. So something is wrong with my screen. There we go. All right. Okay. I think okay. So let me fix the screen because there's a big bar in the middle, right? I don't know what's doing that. Let me try that again. But maybe we can get rid of that. Stop screen. Okay. Alrighty. So I know we have some viewers here. Technical glitch. Sorry guys. Let me reshare. All right. We have Mandy joining us from South Africa, and Rusika is joining us from Nepal. Anyone else here? You can join the chat via the comment section, and I will be carefully monitoring that. Thank you, Mandy, and thank you, Rusika. All right, so I'll try to make a slideshow from here again. Alrighty, having some technical glitches. I haven't done live for a bit now, but anyway, let me just introduce myself real quick. My name is Dr. Nurse Paul. That's my name in social media. So I do NCLEX classes. I've been doing NCLEX classes for the last 17 years, and I am proud to be invited by AMN Healthcare International, one of the biggest healthcare recruiters in placing nurses from all over the world to the USA. I am currently based here in Houston, Texas. Okay, so um, and right now it's about 7 a.m. here in Texas, pretty cold. I've been here in the US for 8 years, already an American citizen. And all right, having issues here. Right, my screen froze already. And let's see, maybe I can share it now. All right, so today, guys, we are going to do an NCLEX class. All right, it's a next generation NCLEX class, which means we're gonna do a case study today. All right. And Mercy is also here. Mercy is my student in Aspire RN. All right. So to give a further overview about what I do is I teach NCLEX classes through my company Aspire RN, which I've partnered with AMN Healthcare International. We have deployed hundreds of nurses under AMN Healthcare International Scholarship Program and also via direct recruiting program of AMN. But we also do this next generation NCLEX class every month for free, live streamed here in YouTube and Facebook. So if you guys are here in the comment section, please join me. Alrighty. And let's talk about your NCLEX. All right. So what is NCLEX? Why do we need to study NCLEX? All right. I'm having issues here in my screen again. So let me do this one more time, guys. Um, I got an error in my iPad, so I'm using an iPad so I can draw onto the screen. Okay, 1 second. Alrighty, and Mercy's here. Mercy, tell them where you're coming from. And Mercy is one of my students from Aspire RN, by the way. So we do NCLEX classes virtually. We've been teaching nurses from all over the world, and which is pretty good. All right. I'm in the business of helping nurses achieve their American dream, and also to share my story to inspire nurses of how to achieve their American dream, when to start, where to start. I'm also an administrator of one of the biggest Facebook group for immigrant nurses here in the US. It's called Lefora, Filipino Nurses to US. I'm also a board of director and executive committee member of the largest organization advocating for international nurses here in the US. We call it Society of Internationally Educated Nurses in North America, or Siena. All right. So that's what I do. Currently, I practice as an urgent care nurse practitioner. I used to be an ER nurse, but currently, I'm an urgent care nurse practitioner. Okay, so that's my photo right there. A couple of pounds ago, Mercy's joining us from Louisiana, and Catherine, all right, is joining us as well from the US. Chosen is asking, do you take pre-NCLEX nurses? Not really. We don't take non-nurses, so you have to graduate from a nursing course until we can take you to the NCLEX class, because um, we only do preparatory classes. We don't do uh, NCLEX preparatory classes. We don't do pre-nursing, all right, if that makes sense. So we don't have undergraduate programs, all right? So anyway, let's talk about your NCLEX, give you an overview. What is Next Gen NCLEX? It's the licensure exam that we use to practice in the USA, Canada, and now for Australia. So Australia started using NCLEX a few years back. We actually have partners in Australia as well. We have Australian nurses. All right. So if you want to practice in any of these countries as an international nurse, which means you're not educated in any of these countries, you would need to pass NCLEX RN. And the NCLEX RN is same version for every country. It doesn't matter if you're taking it for Australia or Canada or USA, you will take the same NCLEX. All right. And Neneth is here. She's joining us from Canada. Priscilla is joining us from Zimbabwe. All right. So, of course, NCLEX. All right. Thank you. NCLEX is computer adaptive. When we say computer adaptive, what does that mean? So this is a type of exam where it adapts to your personal ability, all right? Which means even if you take the exam same time as your friends, you guys would not get the same questions, because the following questions would be based on your answer on the previous question. If you get a correct answer, it will give you next a harder question. If you get an incorrect answer, then it will give you easier questions. So the easier the questions that you get, the more likely you're going to fail. The harder the questions you're going to get, the more likely you're going to pass. All right. So you can start with 85 items, but end towards 150 items. All right. You can stop in between. The computer will stop when it is 95% sure that you are either passing or failing. All right. So if the computer thinks you're also failing, then it will stop administering questions. Minimum items of 85. Total hours is 5 hours. All right. And for us international graduate, I'm an international graduate as well. I took my BSN and master's degree in the Philippines before I moved here in 2017. So I've been here for 8 years already. And then I got my doctorate degree here and my nurse practitioner degree here in the States. But as international graduates, our passing rate is about 53%. Half of the people who will be taking the NCLEX will fail. All right. That's why we built an international NCLEX preparatory class. I do this class virtually. All right. And we help nurses pass the NCLEX, because obviously it's a difficult exam. All right. The preparation is long because you have to understand the American guidelines. All right. Every country has their own different guidelines. For the NCLEX, what you need to remember is the American or the North American guidelines. Usually, US and Canada are very similar. Anyway, even if you're taking the exam for Australia, so for example, right? You still need to know the North American guidelines. So which means your practice in your own country where you get your nursing degree or you got your nursing degree may be different than what you need to know for the NCLEX because the NCLEX is based on North American curriculum. Okay? So that's why we have to build an NCLEX review program. And we have a 98% pass rate, thankfully, and I'm proud of that. All right, for everybody who joins our classes and follow my study plan, we call it the Dr. Nurse Paul method. You can also follow me, guys, in my social media right there, Dr. Nurse Paul, and my company Aspire RN. We do free classes as well. I do live stream as well. I do have a podcast for immigrant nurses as well. So lots of stuff going on in my social media. But today we're partnering with AMN Healthcare International, who's been my live streaming partner since 2020 during the pandemic when we launched our first video podcast. All right. And again, thank you, AMN International, for inviting me today. We have new people coming in today. We have Arlene, Jamaica Arlene. I know Arlene. She always joins me in my live stream in my Facebook page. All right. And Gracie is coming from Singapore. Um, Filipino in Singapore. I love Singapore. One of my favorite Southeastern Asian country. Very clean and um, very nice. Small city state, but lots of stuff to do. But thank you guys for joining. All right. But today we're gonna do studies. All right. There will be 6 questions. What is case study? It's a next generation NCLEX format. All right, where it's like reading a patient's chart. All right, where you get information from the patient's chart and then there will be 6 questions from that situation. The situation can evolve, which means it can grow, it can give us more information as we go further, but each case study has 6 questions. All right, question number 1 would be about recognizing cues, question number 2 would be about analyzing cues, question number 3 would be about prioritizing hypothesis, question number 4 would be about generating solutions, and question number 5 would be about taking actions, and question number 6 would be about evaluating outcomes. All right. So those are the different questions for the case studies, and I'm gonna lead you guys through it in a little bit. All right. We're gonna do a case study today. Would you guys like to do a case study to see what next generation NCLEX looks like? Yes or no? Yes. And continue tagging your friends. Do me a favor. All right. Click that share button. All right, on your Facebook, click that share button to your pages, to your groups, so people can see that we're doing free NCLEX classes here. Okay? Can we do that? All right. I don't have a way to check Facebook right now, so I don't know how many people are watching or how many people are commenting. I do see the comments here, but I'm in a different platform called StreamYard where I'm streaming this. All right. But please do that and don't hesitate to ask questions in the chat box. I can answer those questions. All right. And the other thing is, this is going to be an interactive class. So you are going to help me answer the questions in a little bit. There will be 6 questions, obviously, because it's a case study. All right. And again, this is Aspire RN. Our website is aspirern.com. All right. And we do the program called the Dr. Nurse Paul method. All right. So, based on my own experience as an instructor for NCLEX for 18 years, helping nurses come over here to the US, and also as an immigrant nurse myself. All right. So, I've developed this program, which has 98% passing rate. We have students from more than 40 countries all over the world, and we're using virtual platform through our website aspirern.com. All right. So that's it. And if you guys want more information, do message me in my social media right there, Dr. Nurse Paul. Or you can also message me and my team here in Aspire RN. We're going to get to you as soon as we can. but we can help you with your NCLEX needs. Again, you have to graduate from a nursing degree before you can join the program. All right, this is not intended for nurses who have not graduated from their nursing program yet. All right, it might not help you. All right, but this is geared towards nurses who already earned their degree and working to pass the NCLEX to work in three countries. Right, the USA, Canada, or Australia. All right. And the beauty with NCLEX is if you already passed the NCLEX once, you do not have to take it again. You can just score transfer or endorse to another country. Like, for example, I'm licensed here in the US. I'm licensed to practice in 40 plus states out of 50, all right, because of compact agreement. All right. And I can also practice in Canada and Australia if I want to. I just need to apply to their boards, but I don't have to take the NCLEX again. All right, which is good because last time I took my NCLEX was 2008. That's like 18 years ago or 17 years ago. Do the math for me, please. Um, Maja is joining us from Kenya. Thank you, Maja. All right. If you guys are ready, we are going to do a case study. All right. And I'm going to read it for you guys. You're going to tell me the answers. All right. So, are you guys ready? Tell me you're ready. Say ready in the comment section. That's totally fine, Priscilla. As long as you graduated from the nursing program already, then we can help. Mary, yes. Mary said, can I apply if I already have my LPN license and I'm waiting to get my RN license? Yes, absolutely. But what application for the NCLEX or for employment? For employment questions to AMN Healthcare International, they would be able to help us. All right. For NCLEX, I could help you with that. All right. But AMN Healthcare International has a lot of resource for those who wants to practice here in the US. All right. We've helped hundreds of nurses in partnership with AMN Healthcare International, and they are now successfully practicing here in the US. All right. All right. I see many people who are ready. Okay. So we'll try this case study from NCSBN, the National Council for State Boards of Nursing. They are also the organization who makes your NCLEX. All right, they're the organization who writes your NCLEX questions, who organize your NCLEX for you. All right, so let's try this case study. Okay, let's read this situation. All right, the client reports the nurses in the emergency department caring for a 48-year-old male client. All right, we have a 41-year-old patient. All right, 41-year-old male client. At 11 o'clock in your nurse's notes, it says the client reports nausea, loss of appetite, vomiting, fever, constipation for the past 2 weeks, and abdominal pain rated 710 on the numerical rating scale, 7 over 10 for 1 week. Client states the abdominal pain started after my 7-year-old child accidentally kicked me in the stomach. Client plays soccer with a child once a week. Vital signs: temperature 103.4 or 39.7. Obviously, pulse 92, respiration 22, blood pressure 130 over 86, pulse oximeter 98% on room air, no significant past medical or surgical history, body mass index of 32, drinks alcohol during social occasions, usually 3 beverages, smokes cigarettes during social occasions. Now look to your other side, which is your right side on your screen. Click to highlight the findings below that would require follow up. What do you think are the abnormal findings? What do you think are the abnormal findings? All right. I'm going to make my video a little smaller because we're going to have a long session later. All right. What do you think are the abnormal findings? Let's go sentence by sentence. Is the first sentence concerning client reports nausea, loss of appetite, vomiting, fever, and constipation for the past 2 weeks? Yes or no? Yes or no? Yes? Yes? Should we highlight that? Yes or no? What happened? Yes? Yes? Okay. So I'll highlight that. But here, because this is a PowerPoint, I'm not going to be able to highlight it, but I can underline it for you guys. Okay. We're going to underline that fever, constipation, because those are abnormal findings. And we need what we're looking for is things that require follow up because they're significant findings, right? I'm also going to underline abdominal pain because that's the second part of the sentence or second phrase of the sentence, all right? Second phrase of the sentence. Alrighty? How about the abdominal pain started after my 7-year-old accidentally kicked me in the stomach? Is there anything that requires follow up? Yes or no? Or pertinent to what we're looking for? We still don't have a diagnosis. This is just question number one, which is all about recognizing cues or finding your abnormal findings, pertinent positives or pertinent negatives in your history, which means every information that could tie us to a diagnosis later. Yes? So I'm going to underline that as well because that may be telling us something that requires us to do a follow up or to diagnose at a later time, right? Because we're going to do diagnosis in a little bit, right? What else? Vital signs. Every abnormal vital signs. Oops, what happened? Every abnormal vital signs is obviously included, right? So temperature 103.4, right? Because it's telling us. So that's 1, 2, 3, 4 so far. What else? Are there anything else that we missed? Are there anything else that we've missed? Yes or no? Be careful with highlighting question types of question because this is a right minus wrong question, right? This is a right minus wrong question, right minus wrong question. So which means if you get an incorrect answer, you get a deduction. All right. But today we have four options and we got all four of them. All right. So remember the abdominal pain, the GI symptoms that we have, the how the abdominal pain started that may be relevant to later symptoms, your temperature, pulse, RR. I'm not going to be worried about that right now. Mercy, because RR is a little elevated. It's not critical to where it's above 30 or above 40. Blood pressure is, it's 120 over 80 or below. 130 over 80 in emergency, mercy, it's not an emergency. So we're not going to prioritize that. All right? You got it? It's not an emergency. Hypertensive crisis, 180 over 100. Shock is less than 90 over 60. So 130 over 86, there's no problem with that. Okay? It's not relevant to the topic because it says requires follow up. So that blood pressure, I'm not going to be worried about that. So we got four. Okay. So what is going on here on my screen? Of course, my screen starts acting up when, um, hold on, guys. I'm not sure what's going on, but okay. Oops. Keeps disconnecting. Anyway, uh, hold on, guys. 1 second. Okay. Okay. My screen keeps acting up. I haven't done live stream for a bit. Sorry about that. All right. So that's it. BMI is not relevant in the topic. Mercy. We're looking for emergency findings. Okay. In highlighting, you don't highlight every abnormal finding. You're only gonna highlight relevant to the case. All right. Because if you highlight everything, well, smoking cigarette is also abnormal. Drinking alcohol is also abnormal. Do we need follow up right like now, like in emergency? When I say I need follow up, oh my God, you're a smoker. I need to recheck you. Okay, how long do you smoke? Guys, the patient's here for abdominal pain. right? Focus on the abdominal pain. So I'm focusing on GI, all right? Okay, now we're gonna do question number 2, which is analyzing cues, all right? Analyzing cues. So don't overanalyze as well. Remember, the more that you answer and it is incorrect, the more you get, um, the more that you get deductions, right? Okay, Dina, I already said earlier. Yes, RR is 22, but it's not critical. All right. The patient is in pain, obviously. So I would not worry about it now. All right. You got it? 12 to 20 is normal, but it's not critical. 22 is not that very high. All right. You can click it if you want. I'm not. It says requires follow up. Do I need to worry about an RR 22? Over a blood pressure of temperature of 103, I would absolutely not be worried about an RR22. All right, right? That's not a priority right now because, like I said, obviously the symptom is GI symptoms. I'll focus on the GI symptoms, right? Alrighty. Now here, this is called matrix grid, right? There's 3 columns: bowel obstruction, appendicitis, ruptured spleen. Same situation on the left side, right here at the top. And it says here, client reports nausea, loss of appetite, vomiting, fever, constipation for the past 2 weeks, and abdominal pain rated 7 over 10 on the numerical rating scale for 1 week. Client states the abdominal pain started after my 7-year-old child accidentally kicked me. I'm not going to read it again because it's the same situation, right? Let's go to the right side to the question number 2. For each assessment finding below, click to specify if the finding is consistent with the disease process of bowel obstruction, appendicitis, or ruptured spleen. Each finding may support more than one disease process. This is like a select all that apply, but going by columns, all right? By column. So we're going to do by column: bowel obstruction, appendicitis, ruptured spleen. Be careful with this type of question because every incorrect answer you get a deduction as well. All right. If you are not familiar with Next Generation NCLEX, I did a whole series in my YouTube and Facebook. Follow my YouTube here in Dr. Nurse Paul. Dr. Nurse Paul or Aspire RN. My YouTube is Dr. Nurse Paul. And you can see all the past videos that I did with Next Generation NCLEX. I explained what Next Generation NCLEX is there. I explained the point system, all right? Different types of questions. So this one right here on your right side is called matrix grid, or select all that apply in a form of table. So we're going to do by row. I'm sorry, by column, all right? We're going to start with bowel obstruction. What are the things I'm going to check for you guys? All right? We're going to do bowel obstruction, all right? Or small bowel obstruction, all right? Do we check appetite as consistent to bowel obstruction? Nausea? Yes or no? Yes or no? Loss of appetite? Loss of appetite? I don't think there's a loss of appetite in bowel obstruction, all right? But do we have a pain of about 7 over 10? Yes. All right, high level of pain. I'm going to check that. In the NCLEX, you're going to click it, okay? How about bowel pattern? What's the bowel pattern here? Constipation. Yes or no? Can I check that for you guys? Can I check that for you? Yes or no? Imagine if you have a small bowel obstruction and your intestines are twisted. Can you have bowel movement? Can you defecate? Yes or no? Yes or no? Absolutely not, because your intestines is not going to move, right? You're not going to have a bowel movement. So constipation, yes, we are going to check that. Very good, Jersey. How about gastrointestinal symptoms like nausea, vomiting, fever, constipation? Yes, those are all sounding bowel obstruction for me. Yes, because small bowel obstruction, they develop fever, right? Nausea and vomiting, definitely, and constipation. Alrighty? Appendicitis. Appendicitis. Yes or no? Appetite. Yes, absolutely. Because appendicitis, there's anorexia, right? Pain. 7 over 10. Yes, it's actually a strong pain too. All of them would have pain, including spleen. I'll check that now because obviously these are all acute abdomen or inflammatory responses, right? How about bowel pattern like constipation? Correct. GI symptoms? Correct. All right. So all of these tell me maybe appendicitis. Them are symptoms of appendicitis. So here's the problem with case studies, right? Case studies are high level question. If you're not good with your pathophysiologies, if you're not good with your signs and symptoms, it will be hard to answer these, right? Ruptured spleen from trauma, for example, because the situation says the child kicked me in the stomach. Okay, so we're gonna consider ruptured spleen, but appetite, no, loss of appetite, right? So usually loss of appetite is more inflammatory responses or infectious processes, right? Ruptured spleen is probably trauma related in this situation, so I'm not gonna include that. Pain, definitely yes. All of them would have pain. Constipation, not so much of a constipation or diarrhea. It is not an intestinal or colonic problem. It is a spleen problem. And the symptoms like nausea, vomiting, fever, constipation, not so much. With ruptured spleen, you're going to look for what happens with ruptured spleen. Are you going to be bleeding? Yes or no? Yes or no? So you're going to look for shock like symptoms, low BP, elevated heart rate, right? Dizziness, disorientation, increasing girth in the stomach, right? We might also see some bruise in there, very painful, right? So that's it. That's it for ruptured spleen. Okay. So knowing this, what do you think is our diagnosis so far? Looking at the check marks, what do you think is the diagnosis so far? I think we know the diagnosis already. What is what is looking like our suspicion, hypothesis? What's our hypothesis so far? Is it possibly appy? Yes or no? Possibly appy? Yes or no? Yes. We're going to find out. We're going to read the case study further. But for now, let's leave it like that. Those are the answers. And this is called matrix grid or matrix select all that applies. So, guys, in the actual NCLEX, you're going to click that. You can also unclick if you want to unselect. All right, but be careful. It's a right minus wrong question. Okay, so now let's go to the next question. All right. Okay. All right. So here it is. Same situations. I'm not going to read anymore. All right. We're now in prioritizing hypothesis. We know that our diagnosis is appy or appendicitis, correct? Appy or appendicitis, correct, nurses? So what's our three complication? It says here select three complications. All right. The client is at risk for developing. We're going to check three complications. What numbers do I check for you guys? Just three answers. There's six options on the screen. This is another new generation NCLEX question. It's not a select all that apply. It's select a certain number. So it could be select 3, select 4, select 2, select 5, up to 10 options. Okay? Jersey or Gracie said peritonitis. I will check that. Because if you have appendicitis, if it ruptures, definitely peritonitis. Correct? Correct? Okay, what else? Anyone else? Mercy, very good. Septic shock. All right, septic shock, right? Because obviously, if it pops, you can develop sepsis. Sepsis is an infectious process, right? Are there bacteria in the appendix? Definitely yes, right? So obviously, that bacteria. Remember the pathophysiology of appendicitis is fecalith, right? It can go out into your peritoneum, which is sterile, and can cause sepsis. All right. All right. Last answer. Very good, Priscilla. We include peritonitis. Last answer. I need one. Not anemia. I'm not going to be worried about that. It's usually a chronic problem. Cardiac arrest. Patient can die from cardiac arrest. Like what? Is this VTAC or VFib? Asystole? Pulses electrical activity? I think um that's that's not an immediate complication. But what I'd be worried about is hypovolemia, correct? Because imagine if your appendix pops, right, and you develop sepsis, septic shock, and you get vasodilation from the sepsis, and now you have hypovolemic shock, right? All right. Hypovolemia is our most um what's this more appropriate answer. That's also because patients with API can vomit a lot. You got it? Okay. So 2, 3, and 4. If you're incorrect, say for example, someone answered cardiac arrest, don't worry, there's no deductions here. This is a type of question where you don't get deduction, you're only scored per correct answer. Okay? So that's question number 3. That's prioritizing hypothesis, or at this point, you already know your diagnosis in a way. All right? Let's try another question. Question number 4. Same situation. All right? No additional tabs. Usually, guys, if there's a new information, it would go here, additional tabs. So for example, labs or diagnostics, or say for example, doctor's orders. So you would click those tabs. But in these cases, there are no tabs. So it's the same situation. All right, but let's look at your question. The nurse has reviewed the notes from 11:30 or 11 o'clock. This is it. For each potential intervention, click to specify whether the intervention is indicated or not indicated for the client. Indicated or not indicated. How about clear liquid diet for a patient with appendicitis? Yes or no? Indicated or not indicated? You can put I for indicated and for not indicated. Come on, help me out. Clear liquid, indicated or not indicated? Is appendicitis patient, is this patient surgical? Yes or no? Will the patient need surgery? Yes or no? Yes. So if the patient will need surgery, very good, Gia. All right. It's not indicated because the patient should be on NPO, correct? Patient should be on NPO, right? Okay, soap suds enema. Do we need an enema because the patient's constipated? Can we enema a patient with appendicitis? That's an acute abdomen, right? Which means you cannot do soap suds that can rupture, right? You're triggering the stomach to move too much, all right? Anything that can move the stomach can rupture the appendix. We have to put the patient into complete bed rest right away in preparation for surgery. No enema. How about heating pad to the abdomen? If you have appendicitis, you're having abdominal pain, it can rupture. Can I put heating pads? No. All right, because heating pads may contract your muscles and can cause potential rupture. So nothing. You're not going to do anything other than give pain meds, give IV fluids, give antibiotics, and send to the OR, right? How about abdominal girth measurement? Measure the abdomen, yes or no? Or indicated, not indicated, I or N? I or N? I or N? You can measure the abdomen because that may tell you if the patient already is having peritonitis. Bloating, increasing abdominal girth, rigid board-like abdomen, abdominal distension are the symptoms, right? Fever, hypovolemia, abdominal distension, decreased abdominal sounds, rigid board-like abdomen. So yes, abdominal girth measurements. All right. How about um, CT scan, abdominal CT scan, yes or no? But it's okay if you got this incorrectly, you're not gonna get deductions in this type of question. Human Arab said yes. Very good. We are going to include CT scan because we're suspecting API. For those who are late, thank you for joining. But we're doing a next generation NCLEX class, and we are already in question number 4 of this case study. We're thinking appendicitis. All right. Very good. What's your score here? Who got 5 points here? But you get the point, guys, right? This is just an exercise. And I've done a lot of case studies already in the past through AMN and through my YouTube channel. You can just check that out. Okay? All right. And if you join me in my page on AMN, you're going to get more free classes. I do it at least once a month. All right? Alrighty, so maybe we can turn off my video for this question only. All right, for this question, or maybe we can move our my video to the other side, ma'am. Alrighty, so for this question, we have more information. Question number 5 is about taking actions, right? We have more questionnaire or situation. Look, right? Earlier we only have 11 o'clock, but now we have 11:30, 12:30, 12:45, 14 o'clock, right? At 11:30, thank you very much. All right. By the primary healthcare provider about client status, awaiting orders. At 12:30, the client was transported to radiology department for abdominal computed tomography or CT scan. Let's check the CT scan. Let's go to diagnostic results, right? You see the tab at the top, guys? Yes or no? Yes? You see the tab at the top right there? We clicked it, all right? So that's case study for you. You can actually have many tabs, probably another tab here, probably another tab here. Your goal is to read all of those tabs because it's like reading a patient's chart, right? What did the abdominal CT say? We have what? At 14:45, we have what? Ruptured appendix, right? Correct? We have ruptured appendix. Yes or no? Yes? 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 Okay, so be very careful with that, okay? So we now have a ruptured appendix. Let's see the nurse's notes, all right? Nurse's notes at 12:45, we inserted an IV. We give the patient fluids, zero point 0.9 sodium chloride at 75 ml per hour. At 14 o'clock, look at the temperature. Temperature went down a little. All right, pulse elevated, right? So we're seeing signs of hypovolemic shock already, but everything else looked good. RR BP looks okay. At 14:15, the primary healthcare provider notified client about client status, right? Other order received for an additional abdominal CT, but we already know that at 14:45 we now have a ruptured appendix. Okay, we now have a ruptured appendix. So let's look at the question. This is question number 5. Taking actions are basically interventions. All right. Sorry about that. The nurse has reviewed, I'm looking here, your notes. All right. And diagnostic results. Complete the following sentences by choosing from the list of options. So in these types of questions, guys, the nurse should insert, when you see the word select and this arrow, you're going to click that in the actual NCLEX. All right. You're going to click that in the actual NCLEX. So let me go ahead and click that button. All right. These are our options. The nurse should insert what? You now have a ruptured appendix. What do you think the nurse would insert? A rectal tube, a nasogastric tube, an indwelling urethral catheter. What's the answer? Anyone? Any answer? So imagine you now have a ruptured appendix. Patient's gonna go to the OR. This is a stat emergency. I'm sorry. Emergency. Open. What's this? Open abdominal surgery, right? So this is a stat procedure. The patient cannot wait, obviously, because patient's gonna die from hypovolemia and sepsis. Any answers? Gracie already has her answers. How about the others? I'm waiting for more answers. Come on. I need more answers. So we'll remove rectal tube. We're torn between NGT and an indwelling catheter. All right. The answer is NGT, right? You want to decompress the stomach right away. Okay? Because patient's gonna have surgery anyway. We don't want patient to aspirate during surgery. Plus, more pressure in the stomach can cause more complications as far as peritonitis is concerned. Okay, Indwelling catheter, I mean, if you're talking about OR, they're gonna put an indwelling catheter because patient's gonna be out for anesthesia, right? But our concern is NGT at this point. All right. It would be a priority for the nurse. Second question, to request a prescription for what? I think I've mentioned this earlier. Analgesic, yes. Antipyretic, yes, because patient has fever. Anti-infective or antibiotic, yes. But which one? I can only choose one. What do I prioritize over the three? Fever, pain, or infection? Anyone? What do I prioritize? I'm waiting for answers in the chat box. And we're going to do more of these lessons at least every month, all right, when I can. I'm also busy because of the work that I do, right? But we probably could do this at least once a month, all right? Answer? Answer is anti-infectives. Very good. Antibiotic, because we're going to do surgery. Obviously, peritonitis is a problem. It can lead to septic shock. Alrighty. And what's next? The last one is the nurse should prepare the client for surgery within. Guys, I said this is a stat surgery, emergency surgery. This is not elective. So choose the lowest time, right? As soon as possible. What's the answer? The patient cannot wait that long because infection can spread, peritonitis can cause more complications. What's the answer? We have an option between 6, 8, or 24. Answer the lowest number 6. I would honestly not wait 6 hours, but perhaps in the next 2 to 4 hours. But I mean, that's the lowest number that we have. So 6. You got it? You got it? All right. And question number 5, we have more notes here. The diagnostics we're not going to open anymore because it's actually the same. So we're not going to open diagnostics anymore. But in the NCLEX, just be careful. One of the strategies I teach my students is to ensure that you guys are reading everything in the screen. All right. Hold on, guys. All right. Where is my. All right, cursor. All right. Oh, all right. Okay. All right. Okay. One second. All right. Okay. So what are the answers here? Let's read 18 o'clock question right here. Or a situation. Right. So for 18 o'clock, guys. Oops, sorry about that. Client is now transported to the OR for an open appendectomy. And then at 20:30, we're now in the medical surgical unit. All right. And what do we see? We see a patient. Sorry about that. All right, transported back to the MS unit. At 22:30, we see the patient is now coughing, deeping, right? Every hour, that's good. Patient's already on incentive spirometry. We're doing post-op leg exercises. We have NGT that's been removed already, which means we don't need to decompress anymore. Patient is now drinking clear liquids. Abdomen is board-like, I'm sorry, with diminished bowel sounds. There's still rebound tenderness. Okay? Which of the following would indicate the client is progressing as expected? We're looking for positive signs of improvement, right? Patient is improving very well, correct? As expected, all right? Progressing well. So we're looking for positive signs that the patient's progressing, all right? Click all that apply. We're looking for progressing as expected. We're looking for positive signs that the patient is recovering well. We're not looking for abnormal signs. You got it? Read the question properly. All right? So you can get the question correctly. Select all that apply. Again, if you get a mistake, you get a deduction. Okay? Be careful with select all that apply. You get deductions from incorrect answers. What is it? Very good, Gia. Very good, Mercy. a clear liquid diet. That means patient can now tolerate liquids without vomiting. That's good. If they're still vomiting, then they're NPO. Board like abdomen. No, not a good sign. Rebound tenderness, not a good sign. Incentive spirometer, yes, which means they can breathe and without pain, right? Because the problem with post abdominal surgery, it's painful. So they try not to breathe because it hurts when they move their stomach. But that leads to pneumonia or atelectasis, right? Diminished bowel sounds, no. All right. We should be hearing bowel movements, all right, before we can actually start diet. So make sure there's bowel sounds before we can start clear liquid diet, right? How about leg exercises? Yes, that's for prevention of DVT. Alrighty, all right. That was it. It was a short exercise. All right, and next month we're gonna do this again. Follow Dr. Nurse Paul. All right, to get more tips and tricks for next generation NCLEX. All right, that's my social media right there, up there. All right. Give me a follow. Give me a follow. Thumbs up. And this video will be recorded in AMN Healthcare International's YouTube channel and Facebook. So you guys can still watch this later. Your friends, we're from different time zones. Maybe they're asleep, maybe they're at work. Tag them so they can watch this later. All right. This will be helpful for their preparation in the NCLEX, for the NCLEX in the future. And like I said, if you guys want a full NCLEX review program, we cater to international nurses all around the world. We have an online portal under aspirern.com. Very intuitive, very helpful. We have 5,000 plus questions in our question bank. We have 42 live sessions. We do personal mentorship. All right. We do individual mentoring on top of the group classes. No other centers or review courses provide that level of mentorship. All right. But that's important for me because I like my nurses be helped personally. All right. I don't want you to guys just go into class and we don't care about you. Right. We want to make sure that all of you would have individual experiences. And that's why we have 98% pass rates and we are next generation NCLEX ready. All right. You get 100% guaranteed NCLEX pass by Dr. Nurse Paul. All right. And before we end this video again, next month we're going to do another show. So please stand by. Watch out for AMN Healthcare International's announcement. Watch out for my social media announcement as well at Dr. Nurse Paul for the dates and time. All right, and you can join us online as well. Follow me on YouTube as well. There's lots of information there. I have podcasts. If you want to move to the US in the future, lots of podcasts that can help you there as well. All right. So, Dr. Nurse Paul. And before we end the show, I would like to tell everybody um, I'm a very optimistic person. I start the day, end the day with optimism and I say these words of affirmation, all right? Very helpful, which can motivate you to get your goals, all right? To fulfill your dreams, all right? And for those who are aspiring to become an American nurse, Canadian nurse, or Australian nurses, remember that I was once like you some 18, 19 years ago, but my life is a living testament of dreams, of determination, of persistence. And whatever you're going through, whatever goals you have, it may be challenging, there might be obstacles, but keep on, all right? Focus on the prize. Yes, you can. Thank you very much. Thank you, AMN Healthcare International. And I'll see you guys soon. Thank you, Gia. Bye.